As we've discussed here on the show before, DC is requiring students who are 12 and older to be vaccinated against COVID to attend school this year. Douglas Blair, news producer at the Daily Signal, pressed DC Mayor Muriel Bowser on this decision and how it could disproportionately impact Black students. Let's take a listen.
My name is Doug Blair with the Daily Signal, and the question I have is that we have reporting that around 40% of Black students in the district are unvaccinated, and therefore, under the district's current policy regarding schools, will be unable to attend school come the school semester starting. So why is the district continuing with this policy when it seems to disproportionately impact Black students?
I don't think that number is correct. We have a substantially fewer number of kids that we have to engage with vaccination. And I explained why it's important. It's important for the public health of our students and that we can maintain safe environments.
Blair posted a chart from the Washington, D.C. coronavirus response website where he says it is evident that the 12 and up age bracket has a vaccination rate of 60%, meaning that 40% of Black children are unvaccinated. And so, Briahna, seems like either the mayor didn't know what the data was or didn't want to face it openly, but also this is a strange policy for DC public schools, I think, with just basically a week and a half until schools start, because I don't think that there are a lot of people, even say at the CDC or the FDA, who would say that the current vaccine designed for the wild variant, the alpha variant, is significantly effective against BA.5. Now it might mitigate symptoms slightly in the 12 to 18 age range, but because it's so mild for the 12 to 18 anyway, it's hard to measure that, and they haven't produced this kind of new variant vaccine, and so they're going to keep kids out. And also, it doesn't seem like there's any effort to factor in whether or not you have been infected in the past by COVID, because if you add that to the 60%, you probably get well over 90% for these kids.
Yeah, well, Mayor Bowser's stance here is out of step with the policies that have been, implemented across the country more broadly with respect to kids returning to school in the fall. It does represent an outlier case requiring vaccinations in this group, perhaps for the reasons that you articulated. The rationale about vaccinations preventing spread is, long dead and kind of in the past, came and went with variants that we can barely remember the names and letters of. And now we're in a new world where we are acknowledging that the things to do to prevent spread are other kinds of policies which are also unpopular among conservatives, like using higher quality masks, like having ventilators in classrooms, et cetera. But instead of emphasizing those kinds of interventions, it does feel like a really unfortunate self-own and kind of unforced error in terms of political liability to try to force vaccination when there's not much in the way of proof that it's going to improve outcomes here. I'm also curious to see how this plays out as we get closer to the start of the school year. Is it really going to be a reality that they bar kids from coming in on the first day of school if they don't have whatever documentation it is that proves they've been tested? Or is there going to be a last minute revision of the policy when they do see that there is a significant amount of the population of all races and backgrounds that is likely unvaccinated or unboosted at least?
Yeah. I mean, I feel like they're going to have to revise this. It's just under the pressure of so many kids being ruled ineligible to attend school, which would be just a complete disaster for them. And this is on top of the inequities that we saw over the last year and a half. DC was not an outlier in the way that unfolded, in the sense that children, mostly white, but other well-off children in good school districts, had access to tutors. They have the digital divide means that they have much easier access to the types of to the broadband that they need to do the online learning, which itself was far inferior to in-person learning. And so you saw and teachers, parents, everybody has kind of seen this firsthand, that when when kids returned to the classroom after being gone for like a year and a half or a year plus, the behavioral problems, the anxiety, the issues that they were presented with were just exponentially worse than they had been, pre-pandemic. And if you add on to that more time, kept out of school, you're setting kids back, 2, 3, 4, 5 years in ways that are, practically insurmountable.
Yeah, what's frustrating here is that so much of the policy around school opening, and frankly, openings of all sorts in the COVID era, does seem to have been more about our failure to have adequate childcare support in this country, labor policy with a lot of people who I would argue aren't necessarily good faith invested in learning outcomes for children, very much wanting the adult labor population to be able to get back into work and therefore needing the babysitter function of schools to kick back in for parents. There was this interesting shift, and I think Walker Bragman has written about this, a reporter, Walker Bragman, about how in the early days of the pandemic, there was this sense that you could exploit the moment to really push at-home education as a way to undermine the public school system and the political valences of the public school system and teachers and their ability to go on strike and be kind of a bastion for a certain kind of progressive labor politics. And then at a certain point, there was the realization that the implications for the workforce were so dire that you absolutely needed to start pushing for school reopening, not because you substantively felt like it was safe for kids or were really invested in whether or not there was going to be learning loss, but because there were these implications for the labor market. And it is frustrating to have to read every political choice 15 different ways to try to tease out whether people advocating for one outcome or another are doing so in good faith and with the best interest of kids in mind. But it certainly is difficult to see how requiring vaccinations of this age group at this time is something that should be a priority instead of other interventions like making sure that these classrooms are well ventilated with air purifiers and the like.
Right, and to do all of this when there's no kind of meaningful evidence at this point that this particular vaccine is going to be significantly, helpful to this particular population, just doesn't make any sense at all. Like if this was going to, save thousands of lives, okay, then now we have something to talk about. But you have, on the one hand, all of the obvious costs and harms associated with the policy against no really demonstrable benefit. And we've been hearing from the very beginning that the amazing thing about these mRNA vaccines is how, quickly they can be tweaked. We get a different flu vaccine, every winter, kind of tweaked to the strain that was around or that they predict is going to be. So they're going to do a similar thing even faster. Well, we're 2+ years on and we don't have it yet. They're saying they're going to roll it out, but if they roll it out, if it is actually safe and effective, and it can be proven to be so, okay, then we can have that conversation. But until then, forcing this policy on these kids seems cruel.
Yeah, my cynical brain says that America will do anything to avoid infrastructure projects, like actually updating these schools as ventilator systems. That is something that needed to be done long before the COVID pandemic, with asthma rates being what they are and these buildings being as old and moldy and decrepit as many of them are. But perhaps I am overly cynical. We will obviously continue to cover what is an ongoing story here with the school system in Washington, D.C., and have more rising for you after this.